Hey everybody, I'm going to talk a little bit about obesity today. Obesity is a complex disorder that involves having an excessive amount of body fat. It's not just a cosmetic concern, it's not just about being overweight or not looking good. It's really about having an increased risk of certain health problems such as heart disease, diabetes, high blood pressure. So all that excess body weight can actually cause some other issues for you other than just not looking the way you want to look. How is it diagnosed? Diagnosis of obesity is when your body mass index, sometimes referred to BMI, is over 30. So there's a calculation for BMI, and it's your weight divided by your height in meters squared. So it's a funny little calculation based on your height and weight. So it's not a real scientific thing as far as how much body fat you actually have, but it's a general rule of weight versus height. And so you want that to be within a certain ratio. Another way you can get diagnosed is actually having an exam with your physician. The physician will measure things such as your height, your vital signs, your heart rate, blood pressure, your temperature, listen to your heart, listen to your lungs, and just examine your abdomen and see what your body overall composition looks like. So that would be another way to get diagnosed with obesity. There are a couple of different causes of obesity. One of the biggest, or really two of the biggest ones, are inactivity. If you're not active, if you're not moving your body, then you don't expend enough calories and you don't burn enough energy, and so you might have excessive body weight stored up from that. So if you're sedentary, you can certainly have a higher risk of becoming obese. And then the other thing is going to be an unhealthy diet or bad eating habits. So if we're eating a lot of processed food, a lot of junk food, a lot of extra calories, high fat, fat's not bad, but certain types of fat can be really bad and they can add fat on your body. So those are the two biggest ways to become obese. There are other risk factors involved. There's genetics, so your genes may cause you to store certain amounts of body fat, and your genes will determine where that body fat is distributed on your body. Your family lifestyle, so obesity will run in families, and what that really means is that if your parents were real sedentary, you might actually be real sedentary because that's kind of your lifestyle that you grew up with and you learned, and so it can be sometimes hard to break out of that. Your age can be another risk factor for obesity because as we age, you might have different hormone changes. Obviously, you might become less active as you get older, and so that can change your risk of obesity. And then pregnancy. Pregnancy is actually a condition that can cause obesity because your weight necessarily increases, but if you gain too much weight during pregnancy, or if a woman has a hard time losing the weight after the pregnancy, it can actually cause obesity. There's some different complications that can occur from obesity. One major one is type 2 diabetes. Another one, high blood pressure, stroke, heart disease. These are just a few things that are actually become a higher risk when you have excessive body fat. So you want to make sure that you keep your body fat under control so that you don't have a higher risk of these other problems, because these problems lead to other problems like heart attacks and things like that. How do we prevent obesity? So regular exercise is going to be number one. Exercise can be a wide range of things, anywhere from just walking daily, 15 to 30 minutes a day. You can go to a gym, you can play a sport, you can just go out dancing 3 times a week if you want to. Some people dance in their living room. It doesn't have to be something formal. You just need your body moving so that your metabolism keeps going. This says 150 to 300 minutes of moderate intensity activity a week. It's really broad, but 150 minutes divided by 5 days, that's 30 minutes a day, I think. So 30 minutes 5 times a week gets you to that 150 minutes. So if you can just go for a walk or go to the gym, whatever you find that you like. Everyone always asks me, I'm a personal trainer, they ask me, what's the best workout? Well, it's the one you're gonna do. So find something fun to do, 30 minutes a day, at least 5 times a week. The other thing is to follow a healthy eating plan, really important. I'm also a nutrition coach, and eating doesn't have to be complicated, but it's really simple. Less processed food, less artificial sugars and saturated fats, less alcohol, and definitely more whole foods like vegetables and whole grains. So you want to just be sensible. It doesn't have to be complicated at all, but get healthier with your eating, and then being consistent with both of those habits. That's the biggest part of both of those things. Because you can say you're going to exercise and do it for a day or two, or eat healthy and do it for a day or two, but once you don't do it for a few days, it's really hard to get back on. So you have to be consistent, and that doesn't mean that you never enjoy a day off of exercise or never enjoy that cake at a birthday party or whatever, but just making sure that you're consistent with it for the most part. If you do find yourself in a situation or someone you love that is obese and you need to do something about it, there are certain procedures that can be done when it is severe and when it can't be controlled in other ways. And they're very complex, but just two. One's gastric bypass surgery. A surgeon, I don't even know, I can't really go into this very much, but basically you're creating a pouch in your stomach so that you're shrinking how where food can go in your stomach. And so you're kind of reducing the capacity. And so it's not an easy thing to go through. And so it's kind of a last resort thing for most people. A gastric sleeve, again, it's again very complicated. You actually remove part of the stomach on that one. And again, it's creating a smaller reservoir for food to go into in the first place, so you physically can't eat more than a certain amount. So these are more invasive things that you can do if diet and exercise really just is not going to fix it. There's also other coping mechanisms that you can use to deal with obesity and your journey to not being obese anymore. Write in a journal. You want to express any emotions you have over it. If you have pain or anger or fear, these are all normal, and you want to get it out there, write it out, maybe seek a therapist. Focus, stay focused. Having a partner that helps you exercise or eat healthy is one great way to be focused. So you want to make sure you keep your goal in mind, have your goal posted. If you have a certain number you're going towards, put it somewhere where you see it multiple times a day so that you can make sure that you keep your focus on losing the weight. And really, I think this one's more important than anything else, is you need to relax about it a little bit. And it's easier said than done. It's easy to sit up here and say relax when you've got this big goal or something really hard you're working on. But stress can really, really affect your ability to lose weight. And it's just going to kind of create this cycle where you can't lose weight. And so you want to recognize your stress and get skills that help you reduce and relax. I think that's it. So